All right. So good afternoon, everyone. My name is Jay Avery Frost, and I am Program Manager for the Columbus Urban League Minority Small Business Resiliency Initiative. You'll hear a little bit more about us later in the presentation, but I first would like to turn it to my co-host today, some of my CUL teammates. First up is Jesse Mark.
Hi, good afternoon, everyone. Thanks, Avery. I see some familiar faces here. This is going to be an awesome presentation. I'm totally excited that we have this subject matter, the subject matter expert today to tell us how we can help our businesses remain safe and COVID-free. So as Avery said, I am the director for the Minority Business Assistance Center here at the Columbus Urban League. We do a couple of things here, which is all around our entrepreneur services, where we provide technical assistance, training such as events like today, one-on-one coaching and counseling. We do have a partnership with the state of Ohio where we assist them with their bonding program and their access to capital program. We've got a lot of things coming down the pike here for our entrepreneurs right now. Just wrapped up a grant period. We're getting ready to open up another one here pretty soon. So I would encourage everybody to please follow us on our website so that you can get our information and mailers. And without further ado, I'll kick it over to Kate Curry DeSouza to introduce the rest of the crew and tell you what she does here for us at the league. Thank you.
Hi, my name is Kate Curry DeSouza. I am the interim program manager for the Health Equities Department here at the Columbus Urban League. We've been really excited to be serving the community. We're a newer department here at the Columbus Urban League, but we have been serving the community throughout the pandemic and are proud to be able to partner with Columbus Public Health to be able to bring you up-to-date information that will help you make the best decisions for yourself and your business. So I'd like to introduce Jen Morrell. She is from Columbus Public Health, and she's a liaison officer for the COVID-19 response team. Thank you so much, Jen, for joining us today.
Sure, thank you for having us. My name is Jen, and I am one of the liaison officers here at Columbus Public Health. Right now, we are a team of 3, and I'm joined by my colleague Ann Mail, and our role has been throughout this entire pandemic to provide external organizations, community partners, businesses, daycares, with information and resources they need so that they can navigate the challenges that are brought to us by COVID-19. So we're happy to be included. We've also have on the line Laura Sweet, who is a nurse at the health department, and her specialty area of expertise is infectious disease. And she has been working even in non-COVID times with organizations, facilities that experience high levels of transmission with a variety of infectious diseases. So we're all happy to be here today.
Okay, thank you, CPH and CUL team for those introductions. And I just want to kind of level set as to why we're here. We wanted to provide the up-to-date information on COVID and COVID safety to our small business clients, regardless of your vaccination status, regardless of your employees' vaccination status. We really just wanted to provide you with the most relevant information. So first of all, where are we at with COVID? I'm thinking about Delta versus Omicron, or oh my God, right? Who knows? Whatever the variant is today, but also thinking about what are your health resources, what are your kind of insurance resources, and like PPE, social distancing, et cetera, so that you have a well-stocked toolkit and you can make the best decision for yourself. And so we really wanted to provide you with some expertise. I do believe that we're going to hear a little bit about best practices from Columbus Public Health. I'm not sure who the best person is to turn it to, but is that Laura?
Sure, it's Jen. I can start. We really wanted to keep this very conversational and really, give you guys an opportunity to ask your questions. So there are a couple key messages that we want to make sure that everybody is aware of. And if you leave with just a few things, these would be it. So the first, of course, is, I think we're all aware, unfortunately, the pandemic is far from over. It's likely going to be something that we're going to have to learn to live with. So that's really one of the reasons that we're here today, to make sure that you know that Columbus Public Health is your partner in doing that. And we're here to assist you with whatever questions come your way and navigating some of those challenges that are brought to you by COVID. The second message is getting vaccinated is truly our very, very best tool to slow the spread of COVID and help get us all returned back to normal, as well as keep your business operating and thriving. Third point here is that since COVID spreads through the air, wearing a mask truly helps protect yourself and others from getting COVID. And since the city of Columbus is still designated by the Center for Disease Control as having a high COVID-19 transmission rate, there is an indoor mask mandate that is currently in effect in Columbus, and we're prepared to answer questions about what that really means for you as business owners, for your clients, for you as individuals, and of course, when do we first see that mask order mandate being lifted? Of course, we want you to stay home if you're sick, encouraging your employees and having your employees stay home if they're sick. You just don't want illness in the workplace. There is testing resources available for anybody who isn't feeling well to make sure that whatever bug they've got isn't COVID, and if it is COVID, taking those appropriate steps. And then, of course, we'll close today with providing information for you all as a follow-up email with resources that we're speaking about, contact information for the CPH team, really what you and everything you need to really partner with us in fighting COVID.
So thank you, Jen. And next up, I want to bring up Sandra Moody Gresham to talk to us a little bit about health insurance and how you can insure yourself. And we're going to go to Sandra, and then we'll talk about some workplace things you can do, and then we'll really open it up for questions. So if anything comes up that you're hearing that you're like, oh, I need to know more about this mandate thing, just have it prepared. And then as soon as we do the brief presentations, we'll open it up for Q&A. So Sandra.
Thank you, and good afternoon, everyone. I am Sandra Moody Gresham, the owner of Dehan Enterprises Insurance and Financial Services. And our office is actually right next door to the Columbus Health Department, right at East Main and Parsons Avenue. So I'm glad to be here to partner with the Health Department and certainly with the Columbus Urban League. But just to hit on a couple of things, that we are in health insurance open enrollment. It began back in November 1st, and it continues this year through January 15th. So it's an extension of about 30 days additional than previous years. So this is Marketplace, it is Obamacare, and in essence, premiums are lower than they have been in the past due to some recent law changes. So there are many people getting coverage paying $0 a month or $20 to $50 and greater. So income is the factor that determines what your premium will be, but there are rich, robust plans literally for $20 a month. So this is a window when if you have not had health insurance, you can apply and enroll in coverage. Couple of other important benefits, there are free wellness, which is your annual preventive health screening. So the mammograms, PSAs, colonoscopies, those primary wellness checks, immunizations for children are all free on these plans. There is no medical questions asked. So there's no pre-existing condition. So everything is covered through these Affordable Care Act compliant plans. So again, you have until January 15th. If you apply before December 15th, coverage will be effective on January 1st. between December 15th and January 15th enrollments, coverage would be effective on February 1st. So I can make sure, Avery, you have the information, and I'll post it in the chat, links to where you can access coverage. You can certainly do it through our websites, but you can go to healthcare.gov directly if you're in Ohio. About 35 states use healthcare.gov. So these rates and benefits are available for everyone. And in a climate we're in, you want to be able to get care if you get sick with COVID or any other illness. And it's really unfortunate that many people are not taking advantage of these low-cost health insurance plans. So I encourage you, if you know family members, friends, that you share this information, because many people just don't know that these avenues are available for them and very, very affordable. The other insurance I would like to mention is disability insurance. If you become ill and cannot work, or you have an accident and cannot work, how does your family get income? Disability insurance replaces your income, generally up to 2/3 or roughly 70% of your income can be replaced while you're home recuperating or while you're hospitalized. If you're under age 60, there's about a 35% chance that you will be disabled for 90 days or longer in your working career. So this is one of the greatest risk people have, and there's a very small percentage of the population that insures for disability. More of us buy dental insurance than we do disability insurance. So you have to think about, if you can't work, how would your family receive income? So these plans can be purchased individually. They can be purchased in the workplace. Many employers offer a group disability plans, which are very, very inexpensive. And these are also your voluntary plans like AFLAC or Colonial. So it's important during this last quarter or last month of the year, many employers have open enrollment. So now's the time to take advantage of these plans and enroll. Because with sickness, accidents, we never know when they're going to happen. So it's important that you have these insurances in place prior to becoming ill or having an accident. And again, I think these plans are very affordable, but you almost can afford not to have them, right? So Avery, did you want me to hit on the business coverage? I just wanted one other business coverage to suggest. That is for employers in particular is cyber and data breach coverage. There has been an increase, a tremendous increase in cyber attacks because of COVID-19 and also because of the transition to remote workers. So what cyber liability and data breach coverage is simply if your systems, if you utilize the internet, if you have online or cloud systems, any of those systems are hacked either internally by rogue or employees doing things inappropriately, or outside cyber attacks. And so what this insurance does is it helps your business continue to operate if you have an attack. And this simply can be providing the forensics to find out what happened, where the weaknesses and gaps in your technology systems are, to lost revenue because you cannot operate because of that hack. And so you are losing money and revenue for it. Some of the common cyber attacks that we're seeing really that have increased because of COVID have been social engineering, or around where if you get a bogus email that's directing you to make a transaction, transfer dollars or funds by an authority that's deemed to be an authority in your workplace. That is one of the areas that we're seeing a lot of increase, and as well as bricking, when I'm learning some of these terms as well, where a hacker can just freeze and take control of your entire system. So your software as well as your hardware. So what these policies do is help you to replace that. It helps you if your systems are attacked with ransomware and you're being required to pay a ransom in cryptocurrency. These insurance policies will negotiate that and pay that ransom in crypto if that's what is deemed to be the best strategy. So this is an area that many small businesses are not paying attention to. But in addition to the insurance, you have to make sure your internal systems are secure. And that is working with your technology professionals. Many times you cannot purchase the cyber insurance unless you've done some significant controls and put in place firewalls and protocols that lessen the risk of this happening. So one of the benefits of this coverage is just not only just in the process of applying, you're having an assessment of your weaknesses and your security measures in place. So it's an important tool. I think any business who uses the internet has that vulnerability and have to really begin to look at this coverage where historically you may not have. So we're here to help. Again, I will note in the chat our contact information, and certainly in the communication that goes follow-up communication, Avery will include this information for you.
Thank you, Sandra. And of course, every time I listen to you, I feel like you raise like 25 questions in my head that I hadn't thought of before. First of all, thank you. And I feel like that we need to have a cybersecurity workshop post haste for our small businesses, especially because we have seen some of that where people are saying that they got hacked or something came up. And when we're talking about COVID, I don't think that we're always thinking about the ramifications, how it does spread out. And so thank you, because I remember last year we did we were part of a grant through the city and county, and somebody got the list of awardees and started emailing them, requesting their bank account information, their ACH, all the stuff. And so I'm like, hey, county, does anybody with a Hotmail email represent you? And we had to send out notices to people like, hey, please do not respond. Some people was too late, but it's really important that we be hyper vigilant when we're thinking about especially our technologies. And that's actually a really great transition to the next point and part where we're going to be talking a little bit about workplace safety, because, you know, we've all been in this for almost 2 years, which is crazy to think that COVID, this has been almost 2 years. But one thing that we're noticing is that, you know, everybody went to this virtual kind of space, but we didn't always put in we weren't prepared to just go virtual. So, you know, you saw right away Zooms were getting hacked and Zoom bombed all in 2020. And so we really want you to think about, you know, how vulnerable are you with your technologies and in your workspace. And so if you're going to be face-to-face, obviously we're all encouraging, you know, social distancing to the best of your ability. If you're consumer touching, literally like a barber, beautician, daycare, that kind of stuff, thinking about how can you distance and provide, you know, some safety within your workspace. But then for like our service providers, if you've gone virtual, what does that really mean? Like, how are you making sure that if you're using Dropbox, is that the most secure way to share the data that you are sharing? Like, is it private? Like, do you need to worry about HIPAA? Like, if we're talking about like a counseling service or something like that, what kind of protections are you and have you put into place for your virtual workspaces? If you're using Teams, if you're using, I don't know, there's a whole bunch of them, like, what is it, Trello? I haven't used Trello myself, but there's a whole bunch of different solutions that you can be using online to continue to do business. So yes, it may be a shift, but you don't necessarily have to stop. So if you've done that transition, we all highly encourage that you take an assessment, look at everything and how you're dispersing your information and collecting your information and identify vulnerable spaces. So that way you can kind of get ahead of it. And especially if, as Sandra mentioned, if you're going to do the cybersecurity insurance, there's some of that stuff you're going to have to do ahead of time. I'm sure that they will probably, and those folks who are experts can guide you through some of that. But first and foremost is what all are you using? Are you even, conscious of everything and how you're transmitting information? Another thing that we were thinking about as far as your workspace, and really just business continuity. That's really what we're talking about. Like, how can you continue to do business in the most profitable and safe way possible? So we want to make sure that you're thinking about a whole slew of things. Jesse, you have something?
I was just thinking, and I want to, piggyback off of what you were talking about as far as, what you need to do to be safe, I don't know if I need to wait for a question, but, every time I talk to Sandra, she has a wealth of knowledge. She is a savant in the insurance community. So we are very privileged to have her on this call today. And, should I wait for my questions for Sandra after?
Oh, you can go ahead, because I have some for her too, so we can just jump in.
So if I can fire a couple off real quick, knowing that we're in open enrollment period, if somebody were to sign up for these coverages that you just mentioned right now, when does it take effect? So, if we have a business owner that contacts you or the marketplace and they say they want to sign up right now, and then next week, somebody in their office or one of their employees or even themselves may be, in close contact or contracted with the virus, when does it take effect? First question.
Yes. So if you enroll now before December 15th, coverage is effective January 1st. If you enroll between December 15th and January 15th, coverage is effective February 1st.
Is that the same case for like the cybersecurity or any type of business insurance that you may enroll in? Is there like a certain window or anything like that?
No. For business insurance, you can establish that at any time.
And another question.
Covers. Oh, go ahead, Jess.
Thank you. How many people does it take to be in group coverage?
So that's a good question. So for small businesses, you can have 2 employees on payroll to establish a group plan. It cannot be husband and wife, right? But 2 distinct employees will make a company eligible for an employer group plan.
I think that's very important too, because a lot of people may have folks that contract for them. And it's really important for everybody to know that has to be a W-2 employee, correct?
Yes, but they have to be employees and not contractors.
Right.
So it's making sure they understand that difference, also.
Oh, yeah, that has been an ongoing challenge that we're seeing, is that people don't actually know what an employee is. I'm talking about people like a W-2 employee where you take out payroll taxes. That's what we're talking about. Not a 1099 contractor. And some people can get themselves into some legal challenges calling a 1099 contractor an employee. Just, an aside to throw in there. One thing I do want to mention is that there are different associations, including our African American Chamber of Commerce here in Columbus, where you can be a member and get access to group coverage, even if you only have yourself as the owner or a single employee. So don't just cut yourself off or, eliminate yourself. Let's talk about the options that are available to you. And then definitely, like Sandra put her information in the chat. I don't care if you've been in business for yourself for 20 years or you just started, there's a way that we can get you health insurance that doesn't necessarily have to mean the killing your business or your pocket, and it's just something, because going to the hospital uninsured is much more expensive than health insurance ever is. So if I can beat a horse today without what's the pet people coming to me, I would say this: get insured, please, and thanks. Sandra, my other question I had for you was about Keyman Insurance. I don't know if that's the official name for it, but have you seen an uptick in people getting Keyman Insurance, and is it something that you might encourage for a business owner?
Yeah. So we're using more socially appropriate names now, like Key Person Insurance. Oh, right. But there's the same thing. It's really life insurance that's purchased for important people. You as the owner, it could be a key salesperson, anyone that's significant to you growing your building or creating revenue for your business. So I would say we haven't really seen an increase, but you're seeing more people just buy life insurance, right, in general. I think people are understanding the need. We're seeing a lot more younger people pass away than in the past. Here's another area where I think people just don't know that insurance is cheaper than they think. Life insurance is cheaper than they think. And, I like to remind people it's cheaper than likely your cable bill and your cell phone bill, and getting your nails and hair done, or a round of golf, right? So to protect your family is critical. The younger you are, the cheaper it is. Yes, everybody needs it. And unfortunately, we really need to insure our young people. We didn't really pay attention to that in previous years, but that has come to light over the last few years.
Sandra, I'd like to add one other thing that you talked about with the disability coverage, especially for all of our self-employed people here, right? If you don't have that group coverage, if you don't work, you don't eat, okay? That could have a detrimental impact to your business, your family, and it's happened. I've seen it in 20 years. I've been helping out business owners. That is a critical piece of information that you touched on, to where every person that's self-employed should have that type of coverage, right? And a loaded question for you, Sandra, and then I guess maybe I'll be quiet for a minute. Does it cost anything for anybody to come and do an insurance audit with you?
No, we'll sit down and review individuals' current plans and then assess them and make recommendations, and there is no cost for that.
Thank
you. No. I think, this point on disability is huge because of COVID. We've seen a lot of people who have been off work for 2 months because they are sick and can't go back to work. And after sick pay, where's the rest of the income coming? Because your mortgage payment is still due, your utilities are still due, and your family has to maintain their standard of living. That's what disability income does. It replaces your lost income. And there's a greater chance for you to become disabled than you are to die at every age. So it's a product people just don't look at. But they raise their hand for dental. Okay, they want dental insurance. And I think part of that is we're a vain society. Okay, but I'm an advocate for disability. I'm a cancer survivor. I was disabled for a year. I was 35. So it happens at any age, at any time. And I know the professionals in the healthcare industry see it all the time. And you never know when you're going to get sick or have an accident.
And I know also that's a really good point when you talk about this coverage, that there are often gaps in those plans as well. And I know that you can provide supplements to have people make sure that they get 100% replacement of their income and not just 50 or 60% of it, correct?
Well, the industry does not want you to get 100%. They do not want you to make more money at home sick than you will working, right? But on those documents you have to complete periodically, you're confirming, you're telling the truth that you don't have other income sources coming in. I mean, that's how that's audited. But the goal is, provide you enough to sustain, cover fixed expenses, and then help you with rehabilitation and get you back to work, even if it's on a part-time basis. So those plans are designed to help you get back to work.
Thank you. One question that has come up in the chat was, so if an employee of yours and you have group coverage, if an employee tests positive for COVID, does that have any impact on your premium? I don't know if you can answer that, but generally speaking.
No, we get that often. You don't know. In the world of health insurance, every year rates kind of go up. Just if there's clean, no claims, no losses. Just in general, rates kind of go up every year. And it's been said, health insurance is expensive because health care is expensive, right? So, I can't give you an answer that yes, it'll automatically increase because you've had someone sick with COVID. You don't know that. It's just the nature of this industry.
Yeah, I've heard that question come up outside of this space as well. And we're, especially in the COVID terms, where everything is such a flexible or moving targets, really, things are changing all the time. So I don't know if we're going to know for sure what the changes will be on the health insurance until we get a little further from it. But that does bring us to I think it's something that is always of concern when we're talking about workplace safety is the budget. A lot of folks, like some of the things that are the best practices that you can put in your company are going to cost you money, just simply, but some of them are opportunity costs for real. Like if you can stay open and you can keep a safe, healthy space, you become a better candidate for business. There are restaurants I walk into and walk right back out of because I'm like, nope. You clearly there are more tables in here than there because I understand. We all know 2020 was hard on, especially on our restaurant tours, I guess. But you have to balance, safety and comfort of your guests with your bottom line. And so part of what we wanted to highlight also was thinking about how can you control your existing costs, especially if revenues came down and the cost of the protections continue to mount sometimes. How do you best protect your bottom line? And so one really key way is to, take a whole review. If you have not already, a lot of us didn't have a choice but to do this last year, but review your financials and your cash flow. Where's your income coming from? What are your expenses, and where can you cut your expenses so that you have more flexibility and more cash flow internally? And especially if you're working, if you have employees, there's some costs you can't cut. But where can you, whether it's these subscriptions, you're paying $9.95 a month and you don't really think about it, and you've been signing up for all these things for $9.95 a month, and that adds up. So how can you cut down some of the costs, or how can you save money and be more efficient with your resources? That is a very big important thing, because you already heard it. I and many of us are strongly encouraging, actually, no, I'm saying specifically, you need to be insured. You need to have health insurance as a business owner, especially because you are your business leader. And if there are people depending on you, you need to make sure that you're covered and you do your best to cover them. So if you're not in a position or a place to offer health insurance to your employees or your contractors, please make sure that they know that it's open enrollment and that there are subsidies available. I can specifically think of one of our clients here at the Minority Small Business Resiliency Initiative who has been uninsured, and she was able to go into the marketplace and get a subsidy, and now she's totally insured for a year at no cost. And when we're thinking about it as entrepreneurs, especially minority or Black entrepreneurs, obviously this is a pain point in most scenarios. Our revenues are lower than other businesses, but what does that mean? Especially when you're underpaying yourself, you are probably eligible for a subsidy to get some health insurance. So in this particular instance, that's helpful. So please don't be too prideful. Go into the marketplace. And if you jump in there, I have no idea how this works, there are people like Sandra and other insurance agents who can help you navigate that space. And so take advantage of those things. Take advantage of the different resources that are available. Yes, they're not as many as there were in 2020, because we are coming out of part of whatever wave. I don't know which wave we're in now, but we're coming out of a wave maybe. And so there are not as many resources, but there are some available. And there are ways that you can be more economical. In our follow-up that we send you, I'm going to send you a number of resources or places where you can get PPE inexpensively, personal protective equipment, like masks, hand sanitizer, all those kind of things. Or you can get them in a wholesale kind of way. So if you're going to be going through them because of the number of people in your workspace, how can you get 1,000 masks for 9 cents each instead of $1 each? Those are the kind of resources that we want to make sure that you have in place so that you can be as safe as possible. And this is not a trick question, but Columbus Public Health, I do have a question. And we're getting some questions in the chat. So that's why we're just going to sprinkle them in as we go. So is there I don't know if you're able to say this, but are there masks that are better than others? Because some people put bandanas on, and I don't know if that's actually safe, or is it the N95? And this is just as a consumer or as an individual, I have this question.
Yeah, thank you for that question. There's definitely the N95s and the medical grade masks. That would certainly be better than, pulling your t-shirt up over your face or putting bandanas on. In most instances, cloth face coverings are sufficient, but to truly have the very best protection, wearing a properly fitting N95 masks, which you need to have somebody do a fit testing for those, is the very best protection. And then there's some other, materials available that, we'll give you some resources for. for getting that free PPE. We're going to be doing a push out soon for the stuff that we have as well. And that stuff is very, very efficient and very, very safe, but doesn't quite meet that top tier of, fitted face masks.
Awesome. And somebody asked about, I'm sorry, face shields.
No,
Go ahead. Sorry, go ahead, Jen.
no, you're fine. I said I'll add on to Anne's response too. I think it really depends on also what kind of work you're doing. So if you're in that personal service space, if you're a massage therapist, if you're if you are a salon owner and you are in very close proximity to a person, the N95 is going to offer you the most protection. And, even here at CPH, our team of nurses who are vaccinating folks, they're wearing the N95 masks because they're in very close proximity all day. But, if you're the receptionist, that cloth mask is generally going, or the surgical mask is generally going to be okay. In kind of, and I heard where you were going with the face shields. Face shields, obviously don't provide nearly the same level of protection because they're open on the sides and underneath. We do see, obviously, in a lot of our COVID safety strategies, it's referred to as a layered effect, where you're piling and, kind of layering protective measures on top of each other. So if you don't have access to N95s, and we'll share resources again for you guys, but if all you've got is a cloth mask or a surgical mask, putting that face shield on in addition, obviously, is another layer of protection, and it's always better than not wearing a mask, period.
I have another question. I know that we're sitting in meetings and things like that sometimes right now where everybody says, I'm vaccinated. Do you mind if I take my mask off? Right? Or we're all vaccinated. Let's take our masks off. How do you guys feel about that from a practitioner standpoint?
Yeah, I can tell you that here at Columbus Public Health, regardless of vaccination status, when we're in a meeting with somebody, when we're not in our own personal workspace, we are masked. That's partially because we are following the indoor mask mandate, but also because that is what is still protecting people best, because while we know that being vaccinated can, definitely lowers your risk of getting the disease and spreading the disease. There's still a lot of breakthrough cases, and that it's just best to have that mask on at all times while you're indoors.
Is this where maybe some of the variants are coming from?
Yeah, Jen, you want to take that one?
Yeah, and Laura, we might have you chime in too as our nurse. On a very high level, the virus, like any other virus, continues to mutate. The variants are certainly very, very concerning. We know that folks who are fully vaccinated are far less likely to get sick, contract COVID. It's still very possible. I think probably all of us are aware of breakthrough cases, even within, small personal circles. And then certainly, we're still learning a lot about this virus. So it continues to mutate. We know that getting vaccinated, wearing that mask is truly the best thing that you can do to protect yourself from the variants, because those who are not vaccinated are much more likely to get sick and, end up in the hospital for longer periods of time and have those lasting side effects. Laura, is there anything you want to add to that question?
I don't know that there's anything that I would really want to add other than with what we're seeing right now in our community, what we're still seeing is cases related to the Delta variant. And we are currently seeing that cases are unfortunately going up right now. And that happened last year around the holidays. Looks like the same thing is happening this year around the holidays as people gather. There's more transmission that is happening, and that's what we're seeing right now in our community. So that would be a reason to do the masking. you know, especially right now, you know, because we know there is so much transmission with folks that are vaccinated. The vaccine does provide a very good protection, but it's nothing's 100%. So wearing a mask provides that extra layer of protection, especially if you're going to be around a lot of other people. It's just an extra layer that protects everybody. So, and as far as the Omicron variant, we're not seeing that yet, but we do know it is in the US, and we do anticipate that it will be here. It's a brand new thing, so they're still learning about it. I've seen some hopeful reports that it may not be quite as severe as Delta, but we'll just have to wait and see. But in the meantime, the best thing for everyone to do is make sure that you get your vaccine and you're being really careful around social distancing and masking as well.
We pulled one statistic to prepare for today, and you know, I think it's pretty impactful. You know, in just a week between November 30th and December 7th, the city of Columbus has seen a 57% increase in the number of cases that have been reported in terms of residents living in our jurisdiction. So, you know, COVID it's not going away, and as people gather, it's just going to get worse.
That's crazy. That's a crazy statistic. And actually that brings, I think, a question that is on a lot of people's minds. It's about exposure and, you know, was it quarantining or whatnot? And this, I've heard this story similar to this around my office like 5 times in the last week. My kid or somebody in my kid's classroom got exposed to COVID. Everybody has to quarantine. Do I need to quarantine? Do I need to test? Like how to, and I don't know that we have quite great guidance other than, you know, yes, quarantine, you know, get tested. But is there anything that you might offer to parents?
Sure, yeah.
Yeah.
So it depends if you are the, oh, sorry, Laura, did you want to take this one?
Oh, I can take it as well.
Okay, all right, go ahead.
So quarantine would be for people who are a close contact of somebody with COVID-19. So contacts of contacts don't need to quarantine. So if the child is quarantining because they're a contact, but they're not sick, then unless they become sick, the rest of the family does not need to quarantine at that time. So quarantine is just for close contacts. We define a close contact as anybody who the ill person would have been around the 48 hours prior to when their symptoms started, or anything after their symptoms started. And that would be close contact, which is less than 6 feet, greater than 15 minutes. Anybody who lives with them in their household would meet that definition of a close contact, and others may as well. So those would be the individuals that would need to quarantine for the 10 days from their last exposure. And now if that person is fully vaccinated, which would be 2 doses of Moderna or Pfizer, or 1 dose of J&J, they don't need to quarantine, but they should still get tested at day 5 to 7. Because they don't need to quarantine because they're vaccinated, they're at less risk, but they're not at 0 risk. And that's why we still recommend that they get tested, but they don't actually need to quarantine at home.
Thank you very much for that. And I guess this next one is a 2-part question. So first, is there somewhere where that people can see that online? Like they can just kind of read through those guidances or refer back to them? And also, the CPH assist individual businesses with this kind of information or safety kind of stuff?
Yes, so yes to both of your questions. After the webinar, we are going to send a 1.5 page of resources that are kind of with web links, mostly to the Center for Disease Control and Prevention's websites that are broken down by topic area. And then of course, you know, I mentioned earlier, Columbus Public Health is available to answer questions of all kinds for businesses related to COVID-19. So our email address, our phone number is on there. Ultimately, those questions will get routed to myself and Anne. And then if we need to bring in a nurse, you know, we certainly do that. So we want to hear from you, because it's not easy to navigate. We get it.
Yeah, I know, just for us trying to keep everything straight is insane, but knowing who we point people to is the best resource available. So thank you very much for that. We've talked about a lot of the things that I wanted to cover today, but I want to open it up for questions from the group. So if there's anything that you want to ask, you can either drop it into the chat or just come on, unmute yourself and you can ask the question. I'm going to bring us back to a gallery. Any questions and or co-hosts, anything that came to mind while we were listening?
This is Sandra. I would like to ask to the health department specialists around the booster. There's been some discussion that after the current booster, there's likely we will need boosters going forward. You know, once a year or a couple times a year, some of the information I'm hearing. Can you speak to that, the impact of these boosters and the likely frequency we're going to require or be suggested that we have them?
Sure. So at this point, it has not been determined how regularly or at what interval boosters will be recommended. The CDC currently is recommending that everybody who is 6 months out from a Pfizer or Moderna vaccine series get a booster, 18 and older, and then anyone who's 2 months, 18 and older, 2 months out from a Johnson & Johnson vaccine get a booster. We know that that'll add extra protection, especially against new variants that may come out. But there isn't at this point in time information about how frequently they're going to recommend getting those boosters. And then I think you had another question, a second part of that question. Did that answer the full question that you had? Okay.
Yes, thank you.
Mm-hmm. And just one other point to add with that, there is, you know, the experts will definitely tell you we're not going to be able to boost our way out of this pandemic. And so while it's super important for people who are already vaccinated to go get that booster to continue to protect themselves, we really do need to focus on people who still have not gotten their primary series of the vaccine. And until we get that number to be higher than where it is, we're not going to get through this pandemic. So we do still encourage people to get that primary series, but definitely agree that it's important to get boosters as well.
I have another question. This may be more for, you know, our businesses that are in that hand-to-hand combat almost for their exchanging currency, exchanging cash, taking cards, knowing that it's, you know, more airborne. Do you have any suggestions or recommendations on how a business owner may want to pivot their business for how they receive money or receive payments?
You know, we do know that the virus doesn't live on surfaces nearly as long as we thought it did, you know, back in March, April, May of 2020. You know, certainly whatever practices businesses can institute, so there's less, shorter durations of interaction with the public, and obviously less opportunities to spread the virus is recommended. Truly the best thing, frequent hand washing, wiping down frequently used surfaces, door handles, buttons on cash registers, copy machines, etc. One thing that, to be mindful of, a lot of people, and you'll see, they'll wear gloves, to protect their hands, but then as they're touching everything else with those gloves, you're almost kind of counteracting, depending if you're not mindful to replace those gloves all the time.
That makes sense, because basically gloves are just additional skin.
You got it.
Okay.
I have a question. I've seen a lot of UV sanitizing wands. Do you have any opinions on those? I know that there are various types of levels. So if I had a good UV wand, for example, would that be good for wanting my mail. I've even seen people want people.
Gosh. We don't necessarily need to recommend that businesses invest in super high tech, gadgets, technologies to remove the virus off of surfaces. I think certainly letting stuff stand like mail is certainly, it goes through a lot of places and gets touched by a lot of hands. Non-urgent things can sit for 24 hours, but truly it's the hand washing. And in the list of resources we do have, and CDC does a nice job about, just providing some general guidance for basic cleaning recommendations. One of the most common questions that Anna and I field from businesses, especially those with, daycares and interactions, personal service businesses, do I have to shut down to clean? The answer is not necessarily. You do need to do a thorough cleaning of all those high touch surfaces, but you don't have to shut it down if you can do it while you're operational. That's absolutely fine. Just, nothing fancy, your Lysol wipes, your commercial grade and home grade disinfectants work too.
I don't know if this is fact or fiction, but I know I've heard that people could be asymptomatic, not have a temperature, but still spread it. Is there any truth to the fact where people have the oxidizers for the fingers? If that shows what your heart rate drops down, is that more of an indicator that you could be positive for carrying the virus or not?
Laura, do you want to take that one?
I was gonna say, I have never heard that before, so I'm I have a guess to the answer, but I
Correct.
Can you repeat the question?
It was a mouthful, I'm sorry. I heard, I don't know if it's fact or fiction again, it could have been posted on the internet, right? But if people are checking their blood oxygen levels, whether it be from a smartwatch or the little thing that you put on your finger when you go to the doctor, which you could buy from Amazon for 15 bucks, is there any truth that that is an indicator, or even more so than if you're running a temperature, if your oxygen levels drop?
So I have heard that is some guidance that some physicians will give patients who have COVID. It wouldn't be something, I have not heard about that as something that someone would want to monitor all the time. But for patients who have COVID as a way of monitoring their health status when they might need to go to the emergency room or go to the doctor, that may be something that a physician might recommend. I have not heard of anything about monitoring that all the time. You would, if you're sick enough to have a drop in your oxygen levels, you would know, you'd have other symptoms as well. So as far as when to get tested, COVID symptoms can be very mild. It can be cold-like symptoms, flu-like symptoms. So we would recommend that if you're having a headache, sore throat, cough, any kind of symptoms, even if you're not having a fever, that you go ahead and get tested for COVID, because all those things can certainly be symptoms, and the testing is widely available. So we would recommend going ahead and getting tested.
Hey, Laura, can I call your attention to a question in the chat too? I started to respond, but thought it would be best coming from you.
Sure. Yes. So after exposure with a close contact, wait 5 to 7 days. That is the recommendation. And the reason for that is that if you get exposed, you're not going to test positive right away. So you want to wait long enough that if you test, that you are likely to be able to detect if you have the virus. So that's why that 5 to 7 day recommendation. And again, that is for individuals who are fully vaccinated. So if you are not fully vaccinated, you do need to quarantine, because the reason for quarantine is we want to make sure that if you were to develop COVID, you're not out and about where you would potentially give it to someone else, since we know that COVID does have that asymptomatic period, and some people may be completely asymptomatic during their entire illness. So that's the reason for quarantine. But yes, the guidance is 5 to 7 days, and that's just so that if you do get it, you are more likely to actually test positive if you test during that time frame. The other recommendation would be that that person who's exposed wears a mask at least until they get that negative test, because that's going to be another way that they can protect anyone that they might be around if they are going to work or going about their normal activities, but they know that they have had that exposure to COVID. And then there's another question here. If required to attend an indoor holiday event, what guidance would you give? So I would go back to those layers of protection that Jen was talking about. There's a variety of different things you can do to make indoor events safer. So certainly wearing a mask is something that can make it safer. Keeping events smaller, having virtual things so that you're not actually gathering in person is certainly something to consider as well. Ventilation is another thing. Of course, it's a little cold to be outdoors, but if you can open a window or increase ventilation, that will help as well. So you want to think about all those things: social distancing, masking, vaccination, and the size of the gathering, and any of those things that you can alter will make it safer. So does that
Thank you.
answer the question?
I think so, to a degree. It sounds like it's a mandatory holiday event. So it might not be too many ways around that. Go ahead, Jen.
I'll add one more thing, and I think, or unless Anne, you want to take it, I was just going to mention the test before you gather campaign.
That makes sense.
So we did Columbus Public Health right before Thanksgiving. I know Franklin County Public Health did the same thing. There's been a huge push across the state, but definitely locally, to get test kits, at-home test kits, into as many hands as possible, so that if you know you're going to gather for whatever reason, and you're right, if you're just the attendee, you may have limited control over, some of those logistical details. So limiting how much you eat and drink and keeping that mask on is the best way to stay safe, but also to take that at-home COVID test before you gather, to make sure you're not unintentionally bringing in unwanted guests to the party. Those kits are available at all the Columbus Library branches. They get regular shipments from the state Columbus recreation centers and community centers. They get regular shipments. We are doing a big push over the next couple of weeks as well, so stay tuned for more information. But certainly the only thing I want to add there is you might call the branch, the library branch, you might call the rec center to make sure they have these free kits before you make the effort to drive. It's kind of hit and miss depending on the day, but do know that they are constantly restocked.
Perfect, thank you. And actually, go ahead, Kate.
That's kind of a follow-up question, is what are the responsibilities of a business to be providing tests to their employees, right? Like, so what if you're an employer and you want to have an event like this? Is this something that you should be sort of responsible for, or should you be sending your employees out to find their own tests? Is there any sort of guidance about this, about that? There's sort of a best practice, and then there's something else. I get it. So we're sort of in that gray zone of what's best practice and what's between best practice and what's mandated. But is there sort of some guidance about testing like that, like to encourage testing with employees?
Yeah, so I would say that's up to the individual business, whether they would want to do that. We certainly recommend that would be an extra layer of protection at an event, or especially if you want to do some kind of in-person holiday gathering, something like that, it would definitely be a great thing to add on. It's certainly not a mandatory thing or something we say you have to do in order to safely gather, but it's just one of those added layers of protections. You want to consider all of the things that we've said here today, as if you'd like to gather safely and you want to do it in person. If you really want to be super safe, you could do the testing and still require masks. With all of that, you would be fairly safe. Still no guarantees, but it's definitely just one of those options out there to help you. It's definitely not something that would be required by anyone. It's a little harder for, depending on the size of your business. If you're 10 people, employees, to go out and find some test kits is a little easier than if you're 100 people or even 50 people, to get the quantity of those.
And is that something that also in the resource list that we have, where employers can purchase those kinds of tests in sort of a bulk format?
Yeah, so in our resources, they can request test kits through the Franklin County EMA, and there is a link in that to that, and those are actually free test kits. Right now, with the supply being, I'd say we have high demand, dwindling supply. We're having trouble meeting all of the requests. For that, we do have to, do some triaging with who makes the requests for those test kits and whether we're able to supply them, to a for-profit business over some of the, community serving outward, human service, type groups for them. So it's not always a guarantee when a business asks for, tests through the EMA that they'd be able to get them, because those are free tests that are provided through the Ohio Department of Health that go out to the community.
Sure.
I'm not personally aware of lower cost tests anywhere, and I don't know if Jen knows anything about that.
I was just going to add, we get a lot of questions from businesses who are looking to get free tests from us, from the EMA, to do serial testing for their employees. And that's not the intended use of the kits provided by the Ohio Department of Health. There are a lot of businesses who, certainly have policies about testing for employees, for unvaccinated employees. So if you have employees who are not vaccinated, there are businesses who say you have to test every so often, you have to test once a week, whatever it is, to prove that negative test. Those businesses are encouraged to purchase test kits directly from the supplier. I know Abbott Labs makes them. We could do a little bit of digging if somebody wanted that information, but those are options. But kits for serial testing of employees is not the intended use of the ones that are provided by the Ohio Department of Health.
Well, awesome. That was some really great information. We're a little over on time, but everybody's sticking around because I think we're all like, yes, thank you, Columbus Public Health, for this up-to-date information. And you're answering a lot of questions, even as you're talking, that might not have even come up as of yet. So I really do want to say thank you for participating today, and for the resources that you'll share after this. We'll make sure that we get you the email list of everybody that registered, so you can share that information with them directly. But just thank you so much for your time. And there was one more question about boosters for kids, if there's any idea on a timeline for that. But I think you answered a lot of the questions that have been presented so far.
Yeah, I apologize. I did see that and we didn't get that answered. To this, as of today, have not heard anything on when that approximate time may come where they would recommend for the younger kids to get boosters. No information on that right now.
No worries. Thank you.
Mm-hmm.
Yeah. Yes, thank you. I know a lot of questions come up as people are watching the news and they're not always sure as to what's like immediately important to Franklin County or Columbus. What do I need to be worried about here right now? I think the only other question I had was about the shields that people use in their businesses, but I imagine it's probably similar to the shields that you use on your face, that if it is open on sides, the COVID still gets around it. But I saw you nodding, so I assume that that is probably accurate. I just want people not to have a false sense of security. So please, as you're putting in the safety measures and you're thinking about what you can and can't do in your business, please just, if you need to reach out to us, like we'll make sure that you have all of our information between the Minority Business Assistance Center, the Minority Small Business Resiliency Initiative, and the Health Equities Department here at the Urban League. We're always trying to collect as much pertinent information for our business clients and our individual citizens that come through the door as possible. One thing that I would like you all, whoever has the information, are there some vaccine clinics coming up? Like, is there a place where people can go to get
We know of a
vaccinated, or should
couple
they just go to
places.
CVS? I wonder.
You know,
We
there's
also
a lot.
have one here at
Yes.
Urban League. We have a family vaccine clinic scheduled for 12/17. That's for children ages 5 and up. For adults, it's for anybody who wants to get vaccinated. And if adults also just need boosted, that's also okay. But if they just need a vaccine, we can do that too. We're partnering with Equitas Health for that clinic, so we can give it to children at our Coke giveaway event, and people can sign up online. We have information out on the social media. We'll be having the follow-up clinic to that on 1/8/2022. We're already in 2022 for dates. That's crazy.
Yeah, there's a lot of choices for folks to get vaccinated. In the reference document that we have, we've included information for those specifically hosted by Columbus Public Health. We've included a link where you can check the state health department's website. So if you're looking for a vaccine outside of Central Ohio for whatever reason, you can find that information and search by zip code as well.
Awesome. Thank you. I was hoping that was a softball. Great. So I just want to say thank you to everyone, my co-hosts, co-presenters, and all for tuning in today. We will make sure that this information gets posted on the MBAC University. I believe, did I call that right, Jesse? MBAC University. Yes, it's an awesome YouTube space where you can see a whole bunch of good stuff for your business. So we'll make sure that you have the information for that, including the recording of this. And please do share this information. If there's somebody who you see who didn't get this, or if there's a peer of yours or a colleague who you think would benefit from hearing this information, please make sure to share it. And we'll also make sure that you always have the up-to-date information as we receive it, whether it's through our emails or through our social media accounts, what have you. Any final points, co-hosts, co-presenters?
I have one thing. This has been awesome. I have so many more questions, right? I think we could have carried this conversation in a 3 or 4 part series, right? So thank you everyone for attending. Thank you for the wealth of knowledge that you provided. Happy holidays, everyone. Thank you.
Yeah, once again, on the health equity side, thank you so much for being willing to gather for this. This has been really fantastic. Columbus Public Health has been an excellent partner with us from the get-go when we started working with COVID relief back a year ago. Which seems crazy, but thank you again so much for all of your insight.
Sure, thank you for having us today.
It was great to be here.
Awesome. Well, thank you, everybody, and we will release you to enjoy the rest of your Wednesday. Please reach out with any questions.
Thank you.
Bye.
Sweet. Thank you guys so much.